All right.
Great. So thank you very much for having me today. It's my pleasure to be here. I should also say thank you very much to the Peer Review Congress for sponsoring me to come out through the Peer Review Sponsored Scholars Program. So these are our conflicts of interest. As Cameron said, my name is Daniel Hamilton and I'm a PhD candidate at the University of Melbourne, Australia. I'll be presenting some findings of a systematic review and IPD meta-analysis looking at data and code sharing rates in medicine. So just before we jump straight into the review, just some quick backgrounds. As we probably all know, there are numerous benefits to greater access to data. So some of these might be they allow us to validate our models and our findings, discover errors, accelerate research, as well as answer questions that may not have been considered by the original collectors of the data. However, these benefits are balanced against issues concerning patient confidentiality, proprietary data, and opportunities to commercialize our data. There are also time and resource burdens associated with sharing and fears within the medical research community around misuse and misinterpretation of our data, loss of credit, and as Lena said before, our ability to publish, discovery of errors, amongst other things. So in terms of the modern landscape, and this is why Lena's talk was great before, there are a lot of funders now and institutions as well that many, if not most, now require data management plans and are strengthening their policies concerning data sharing. We even see some institutions that now freely share their experimental data. In terms of the publishers, there's a growing number of journals that are implementing data availability statements and mandatory sharing policies. A growing minority of journals now review code, and there's evidence to suggest that editors are supportive of reviewers requesting to see data during peer review. There's also calls from the greater research community, like the rare diseases researchers and peer reviewers, for greater access to data. And we know that our patients also support this as well. So sort of like what Paul Glaz, you were saying yesterday, there's been a bit of a Cambrian explosion of articles looking at how often papers share their data and codes. And so this is a review to try and bring all that research together. So the review objectives for this were principally to look at the prevalence of public sharing of research data and code alongside published articles in medicine and health. We also looked at the prevalence of private sharing in response to reasonable requests, as well as factors associated with sharing of either output. We also published a detailed protocol, if you're interested, which was published in F1000 last year. So we had three primary outcomes of interest for this study. So the first outcome was reported availability, which we define as the number of articles that declared that data was available, or data and code was available. Actual availability being the number of articles that were verified by the meta researchers as indeed having shared their data and or code, and fair availability being the proportion of articles that shared their data in accordance with the FAIR principles when it was applicable. We also looked at risk of bias with the domains we were interested in were sampling bias, selective reporting bias, article selection bias, and the risk of errors in the reporting of estimates. And we used a two-stage approach for IPD meta-analysis using the Hartung Knapp Siddick-Yonkman method. So we performed our literature search last year and all abstracts have been double screened, and we currently have 88 articles under assessment, but the grey literature search is not quite done yet. So I suspect there might be another 30 to come still, particularly a lot of COVID studies. But of the 88, these 88 studies, the median number of articles that they looked at was 202, and these articles were published between 1989 and 2020 across 30 unique medical disciplines. And I've just included a table of the top 10 disciplines that were looked at. And so far, only a single study of the 88 has been classified as low risk of bias according to our criteria. So just in terms of our ability to retrieve IPD from this study, I'll just walk through this. So just as a reminder, these are meta researchers principally or secondarily interested in data sharing. So of the 88 studies that are currently under consideration, about 60%, 53 publicly shared all the data we needed for the review. 17% shared some data, but not all data we needed for the review. Of these 15, we've gotten data from 9. We're waiting to hear back from 5, and 1 has told us they cannot share. And then the last quarter of the 88, almost quarter, did not share any of their data publicly. And so of these people, we have managed to get 8 data sets from them. We're waiting on 6. 4 have told us they cannot or will not share, and 2 we have not yet contacted. So of all these 88, we've so far harmonized 61 data sets to date, and we've extracted summary statistics from 3. And these are the results I'll be presenting today. So the first set of results I want to talk about was data sharing rates. So when it comes to our best guess since 2015, we see about 8% of researchers report or declare that some or all of their data is publicly available. However, this halves to about 4% when you actually look to see whether it is indeed available, and then drops to almost 0% when you look at accordance with FAIR principles. Well, this may be a bit unfair because I think FAIR came in 2016. We do have a number of pre-planned subgroup analyses, and so far in the interim results, we note that trialists don't seem to be any more or less likely to share than people who are not conducting trials. Similarly, people who are recruiting human participants for their trials, for their studies, don't appear to be more or less likely to share their data. However, there is some evidence that suggests that people who preprint or share preprints may be more likely to share. However, this is based on the results of one study. In terms of data sharing rates over time, we can see that there's a marked increase in reported sharing rates per year, and this matches really nicely with the results by Sergio in PLOS Bio, which Isabel Bertrand mentioned on day one. But interestingly, when you look at actual availability, there's a bit of a gap between the number of people that say the data is available and the number of people who actually make it available. So when it comes to code sharing rates, disappointingly, our best guess for report and actual is about 1% of researchers have shared their code since 2015. And we did note that researchers who share their data may be more likely to share their code. And perhaps unsurprisingly, when we look at code sharing rates over time, there really hasn't been, according to our interim data, really any changes that we've observed based on the data that we have at the moment. And so the last set of results I'll present today is compliance with journal policies. This maybe ties in well with the last presentation. The review is interested in compliance with institutional and funder policies, but we haven't had any papers to date included in the review that have actually looked at this. So I'll stick to journal policies for this talk. So mandatory sharing policies we looked at, and when it comes to mandatory data and code sharing policies, our best guess for the level of compliance with these policies is about 44% for data sharing and 37% for code sharing. However, there's a lot of heterogeneity associated with the former. So if I just quickly bring up the forest plot, you can actually see that it looks like data sharing or compliance with mandatory data sharing rates does change depending on the data type that researchers are working with. So it may be that people who handle sequence data may be more likely to comply than say people who work with gene expression data. And then in terms of the other data sharing policies you see in the wild, we see about a quarter of researchers comply with the share upon request policies. However, there's not been very few studies that have looked at this over the time, and encourage policies or the recommend policies, as mentioned before, says about a 14% compliance rate, and no policy at all about 8%. However, these numbers might be slightly inflated as there was some quite large, there were some studies in there that looked at sequence data that had quite high submission rates. So in terms of the strengths and limitations of the review, obviously we've put in a lot of effort to try and collect IPD for this study, and having the IPD allows us to look at duplicates in our data set and allows us to do these detailed subgroup analyses. And I think this is the first large scale study I've seen that's looked at actual data availability over time and data types. However, obviously the review is still preliminary, and we have much more than 23 studies left to process. And we haven't addressed the issue of duplicates in our data set. And the review did suffer a little bit from heterogeneity and ambiguity in the way that meta researchers define data and data sharing and things like that. And we also had some challenges designing literature search for this study in terms of trying to isolate the meta research studies that were relevant. So just the final slide, just maybe some food for thought. I thought I'd put here for the publishers and editors in the room. If you haven't already implemented a data availability statement, I'd recommend that you do. And when you do implement any policy governing or concerning data and code sharing, to consider mechanisms to ensure compliance with the policy. And then to the meta researchers in the room, I'd flag compliance with journal, funder, and institutional policies, as well as best practice sharing guidelines, as well as strategies to improve compliance or incentivize sharing as understudied areas in this space. And then the last thing I'll say is we were quite surprised to see about a quarter of meta researchers who were primarily or secondarily interested in data sharing did not share their own data for the review, which is a surprise. I was quite naive when I started this. I thought it would be really easy. And so we'd recommend that we lead by example when it comes to this type of work. So I'll leave it there. These are my details if you want to contact me, and thank you very much for listening.
Great, thank you. Just to be clear about what you're saying if there are journal and policies that journals have, if it's a mandatory policy, obviously you're more likely to people share the data.
Yeah.
Okay. Questions?
It's more of a comment, really. Stuart Taylor
Okay.
from the Royal Society. We have a mandatory data sharing policy on all our journals. And I think our compliance is pretty much 100% because if they don't put a DAS in the article, then we reject it. So that's a relatively straightforward way of getting compliant.
Yeah, good. With an iron rod. Thank you. What we expect from the Royal Society. Question at the back.
Well, yes, I'm Martha from the US CDC. Thank you for the lovely presentation. I was glad you put in as one of the stakeholders patients or the community studies. I wondered if you had any plans for studying how communities and patients or the population studied can also help bring change in this area of sharing open data with the concepts of data sovereignty, et cetera.
Yeah, it's funny you actually say that. So when I returned to Australia, we're about to start a study that will be connecting. So my background's in cancer. I trained as a radiation therapist, and we'll be connecting with cancer patients to kind of elicit their views on this. And there's been quite a few studies beyond the one that I mentioned in New England Journal of Medicine that have done the same. But that's definitely something that we're planning to look at. And there was a couple of great posters yesterday that had done similar things as well. So if you hadn't seen them, I'd suggest that you have a look at those as well.
Great, thank you.
Wolfgang Gersner of Michigan State University. A comment and a question. First of all, very nice talk. Is the physics community, I think, is potentially, I'm saying potentially better with data sharing. One of the things that we have done and that exists is a website called zenodo.org, which is publicly funded and automatically mints DOIs. So that means you can easily upload something and have data sharing, and then people can directly cite it, which helps with the sort of credit motive. The other thing that I wanted to know is, like, in your study, did you then also try to retrieve the data? You might have said this, but I might have missed this.
No, so because it's a review, we're trusting that the meta researchers did all of that for us. So we're not actually, I mean, we had almost 1 million articles in our data set and we haven't individually verified. We've left it to the meta researchers to tell us in their studies whether they've verified it or not, if that makes sense.
Could you automate this process and sort of like at least see the URL is alive?
Yeah, so that's a good point. So we probably could. And I should say, when I talk about there was some heterogeneity in the ways that meta researchers define their outcomes, actual availability was quite a difficult one. So some people range from, was the link broken or not, as opposed to half of the FAIR principles, you know, was it findable, was it associated with a permanent unique identifier, was it indeed downloadable? So there's some differences there, but that's something that we could consider. You know, the only problem has been is with the meta researchers, the difficulties getting data from them is the state that we've received the data in hasn't been particularly optimal in terms of identifying the articles. So there's been a lot of work going into trying to figure out the articles that they actually looked at. So we could do that for a subset for sure though.
Thank you to you and the other members of the team for your service to open science.
Thank you.
Thank you. Final question.
Hi, Hamilton. Very nice talk and presentation, but and very nice. The sample is interesting, and the criticisms inside the sample that you are doing on meta researchers is interesting as well. But how are you defining what a meta researcher is? How is this on?
Great question.
How is this on your search strategy or something? Yeah.
So your question was, how do we define meta research, or how did we find the studies that it was basically, that's what I was saying. There was a lot of challenges associated with finding these studies. So a lot of the searches were just text searches to do with data sharing and code sharing in the abstracts. It wasn't anything to do with meta research, though a lot of these papers do use terminology like transparent and reproducible research practices. So there's been a few little methods that we've been trying to isolate them. And some people in certain fields are just interested and just do it off their own bat. They don't call themselves meta researchers, and medicine might call it methodologists and things like that. So we had a varied approach to try and net these articles, but it was definitely challenging.
To define a search strategy to identify what meta research is really, really challenging, but congratulations for your work. Yeah.
Thank you.
Great, Daniel, thank you very much.